React Africa. So welcome, Professor Murphy Nimpundu. I'd just like to give you the floor to just give us some opening remarks and just welcome the participants and everybody on the call to today's meeting. Thank you.
Um, uh, yeah, so good afternoon, good evening, wherever you are on the globe. As I've been introduced, my name's Amefen Mpunju. I'm the Executive Director for React Africa. I'll just try and give a bit of an overview of React and what this program is all about. In doing so, we often use the terms global north and global south in defining the development, the geographic presence of a country, and this does not in any way strictly limit itself to geographic definition, but it signifies a combination of actually political, geopolitical, and economic similarities among countries. And most of the countries that we work in are in the global south, and we essentially, this program is tailored to the global south, as it were. A little bit about antimicrobial resistance. Whenever we use the term antimicrobial resistance, we're referring to a situation when bacteria, viruses, fungi, parasites become resistant, so they are no longer respond to antimicrobial medicines. These are medicines that they once responded to. Either they inhibited their growth or they slowed their growth. And this particular phenomenon, it affects all countries in the world, but its major consequences are felt in low and middle income countries, or what I might refer to as the global south. In 2021, we had about 4.71 million people who died or suffered from drug-resistant infections such as lower respiratory tract infection, bloodstream infection, and intra-abdominal infections. The new estimates are such that 39 million deaths who are directly attributable to bacterial AMR will occur between 2025 and 2050, which really equates to 3 deaths every minute. And if you look at that in that context, it does add a sense of agency to the problem itself. A study published that focused on 2019, called the Graham Report, again showed us that there are more deaths that are occurring from antimicrobial resistance than are occurring from malaria and HIV and AIDS. In that sense, and so we have more deaths that are occurring, and as a matter of fact, in 2019, there were 255,000 deaths that were attributed to AMR. When we look at the global context, over 36 million lives have been lost to AMR since 1990, and without any great action, AMR will kill about 1.9 million deaths a year by 2050. We look at the regional spread. We see that Sub-Saharan Africa actually has quite a higher toll in terms of AMR, with around 30 million deaths associated with AMR that are forecasted between 2025 and 2050, and almost 7 million deaths attributed to AMR are forecasted within that same time frame. What are some of what is the context in the African region that lends itself prone to the rapid spread of AMR? Some of these are actually economic strains, constraints, where we've got a larger population that are living below the poverty datum line. They live before $2 a day, and nearly half of the population lives on less than $1 a day. We've got critical shortages of human resource capacities in terms of healthcare settings, where the number of doctors, number of nurses, number of pharmacists are far less than the recommended WHO levels. By 2035, we expect a shortage of about 4.3 million doctors in the region. We've got inadequate infection control procedures. WASH, most of the communities lack clean running water, and most of the hospitals equally lack infection prevention and control interventions. There's no running water, fewer gloves are there. Surgical procedures, take place under conditions that are not sterile, and that are not recommended. We have challenges with diagnostics that will be able to let us know what sort of infection that we are treating. We have, most of the population, over 50% of the population, has less access to healthcare. They live in areas and in communities where there are no clinics, there are no health centers, and there are no hospitals. And these contribute to actually what the burden of AMR really is. So what is REACT? REACT is action on antibiotic resistance, and our vision is really to create a world that is free from untreatable infections. We do this through enabling collective action that ensures sustainable and equitable access to effective antibiotics for all. What makes REACT unique? We are four things under one organization. We are a think tank. We provide advice and ideas and solutions as a body of experts in antibiotic resistance. We are a policy accelerator that includes a translation of research into policy and into practice. We do conduct a lot of research that guides our interventions that we recommend for communities, for countries, and for the region, as it were. But we are also an implementing organization that implements projects and who work in the trenches. We do achieve this by working with a diverse range of stakeholders, by using both the top and the bottom-up approach, and by advocating and being the voice of the Global South. We have an advisory board that comprises these great eminent professionals around the world. And we have a REACT team that has these delightful individuals that I'm showing here. What have we achieved over our existence? We have been able to implement and develop a number of national action plans in the region. We have implemented youth programs. We have implemented antimicrobial stewardship programs and surveillance, including IPC programs at national level and in health institutions. We have contributed to policy at the country level, at the regional level, and at the global level. We have supported organizations like the World Health Organization in supporting member countries with their national action plans, both prioritization, costing, budgeting, and with implementation. But we've also worked in communities and also work with civil society organizations and media engagement to promote antimicrobial resistance interventions. We've got three strategic objectives. One focuses on governance and funding of the work on antibiotic resistance. The other one focuses on an approach, which is a One Health approach, and focuses on strengthening health systems using this approach. But we also focus on a public health driven innovation and access to antibiotics and diagnostics. We have supported a number of countries, like I've indicated, I think in the in the African region and also in Asia, where we have supported countries with the development of their national action plan to address antimicrobial resistance, but also the revision of their national action plans 2.0. We just recently finished supporting Iraq with that work and Palestine. We engage regional stakeholders in the achievement of the global strategies and the regional strategies for AMR, and this lends us working with the quadripartite, that's WHO, FAO, and UNEP. We do work with Africa CDC. We do work with UNDP. We do work with UNCTAD, and we do work with regional economic communities. We contribute to high-level conversations around antimicrobial resistance and the way that the global community should respond to that. And our engagement extends as high as contributing to the United Nations high-level meetings. We also weigh in AMR governance and accountability mechanisms at regional levels, both in the African region and in the Asian region. And these two photos show our contribution and our convening of these meetings that were really focused on regional governance and accountability mechanisms. We engage with parliamentarians as a way of engaging with the political leaders at country level. This is one of the meetings with parliamentarians, sensitizing them around issues of antimicrobial resistance. But we also really empower and work with a lot of civil society organizations and media to engage with them. Our work, as I indicated earlier, we work from a bottom-up approach. We take that approach and the top-down approach. Bottom-up approach involves us working with communities. This is showing our work with church groups, where we build capacity, raise awareness, and work on empowerment of communities in terms of healthcare, in terms of addressing antimicrobial resistance, and in terms of infection prevention and control practices. Here we are teaching the elderly, women and children on how to use handless taps without touching the handles. And these interventions go a long way in preventing infections in communities. We raise awareness through innovative approaches, such as the use of social media, the usual use of podcasts, the use of these apps and video links on YouTube that promote interventions that are strong for raising awareness for AMR. But we also work on information, education, and communication materials that we spread and share around for people to be able to see what they can do and their role in tackling antimicrobial resistance. We do promote rational and better use of antibiotics and antimicrobials in hospitals. And these are interventions that we do at the country level, but also at the national level in hospitals. This is just showing one of our innovative projects that is informed by by information research and innovation as key interventions in promoting better use of antimicrobials in hospitals. We host an annual conference every year, and each year we have a focus area where we bring folks and experts from across the African region and Europe and the US. It's become a global conference, and we host that every single year. This year we had a conference in Zambia where we had 38 countries represented, and 156 participants were there physically, and 136 attended virtually. This was our regional conference with a theme from global to local action, operationalizing AMR commitments in African region and beyond. We have had a focus that empowers youths, and where we focus on primary schools, in secondary schools, in colleges, and in just broader community areas. And this is where this program that we are launching here today sits. We recently just supported the World Health Organization in Egypt to build capacity among pharmacy graduating students. It was a 5-day training, and we focused on different areas of antimicrobial resistance strengthening. Our youth engagement and the clubs that we run in the African regions have got a multidisciplinary participation from those that are that will focus in medicine to those that will focus in non-medicines. We recently supported the formation of the Youth Alliance Task Force as one of our contribution again to engaging the youth in the African region. So what is the AMR Leadership Program? This is a program for capacity building, essentially for tertiary students. And, where we build capacities in AMR, in mitigation of AMR, we tackle AMR from the One Health aspect, encouraging students and introducing them to different areas and what they can do about it through their program. We have run 2 programs now. We had our first cohort that graduated, and these are some of the countries that were represented in that cohort. In cohort 2.0, we expanded the reach with 159 students from 11 countries. We delivered 12 interactive sessions. We were able to demonstrate the knowledge gained through improved post-test performance across sessions, and we achieved country engagement, and students were able to implement their lessons through the research that they did at school and the engagement of students. We are now launching the 3.0 that really focuses on really expanding across the African region. It will focus on empowerment, on promoting youth-led community initiatives that link AMR awareness with social accountability. It will advance knowledge. It will create champions that will be representatives in their own communities for the cause of antimicrobial resistance, and it will create a strong alumni network. But also, it will position students who graduate as global leaders. The role of the youth in addressing AMR, cannot be overemphasized. There is that agency that the youth are the larger global population, especially the African region. The engagement and participation is quite critical. You guys can lead advocacy group. You guys can offer solutions on the better ways that we can use in addressing antimicrobial resistance in communities. You can be a key agent in promoting interventions such as vaccinations, hygiene and sanitation, but also in creating knowledge around the better use of antimicrobials in agriculture and in health systems. So with that, I would like to really officially launched the AMRLEP 3.0 program. Thank you so much, and over to the moderator.
Thank you so much, Professor Murphy, for that presentation. And I know it's given the students a lot to think about, the problem of antimicrobial resistance. Definitely their thinking has been broadened, and also just helps them understand the role that REACT has to play or has been playing in the mitigation of AMR, and just highlights the work that we've been doing over the past few years. So thank you very much for that insightful presentation. I would just like to call our next speaker, who is Dr. Matthew Phillip from WHO, and he will be giving us a short presentation on youth engagement from the perspective of WHO. So Dr. Matthew Phillip is a public health physician with a keen interest in AMR and access to healthcare. He is currently a technical officer on AMR at WHO. Welcome, Doc. Thank you for being here today.
Thank you so much and for this opportunity. And it's always a challenge to speak after Professor Murphy, who is also my mentor. But I will take the challenge and try. I'll be rather brief and give you an outline of what WHO is doing to engage young people on antimicrobial resistance and some of our products to support this. I hope my screen is visible and I'm audible. Okay, I consider that as a yes. So this particular slide summarizes all what I want to say. This is a statement which is made by Augusto Baron Cruz, who is a member of our quadripartite working group on youth engagement for AMR, during a multi-stakeholder hearing before the last year's UN General Assembly high-level meeting on AMR. So he kind of made it very clear that young people have multiple roles. One can be as a link between public and technical experts. They can be drivers of innovation, action, and influence. And there is a possibility to have an intergenerational dialogue and exchange of perspectives and capacities, which can help young people to mature and get empowered and have the right competencies to act. So essentially, summarizing what he wanted to say, young people are not passive recipients of knowledge, but they are active participants. They are active partners in the global response to AMR. So WHO also feels that the role is shouldn't be very superficial or limited in its scope, but young people should mature as stakeholders, as active collaborators, helping or rather leading the AMR response globally, and especially true in a young continent like Africa, where the population is really below. The average population is really below 30 years of age. So that youth power will actually show its value in the next decades to come, when the rest of the world is aging. The continent will have a very young population and the demographic dividend which is associated with it. So that kind of gives all the more importance to youth engagement in an African perspective. So if you look at all the global documents, on antimicrobial resistance, the need to engage young people is clearly recognized in all of them, starting from the Global Action Plan on AMR, which clearly highlighted multi-sectoral engagement, which includes dimensions related to young people. If you look at the first UN General Assembly high-level meeting on AMR in 2016, again, awareness and professional education, especially the pre-service training and education, formed a clear recommendation from there. And if you look at the Interagency Coordination Group on AMR report in 2019, again, it called on for systematic and meaningful engagement of stakeholders. We had the WHO's strategic and operational priorities, which was endorsed by the World Health Assembly in 2024. Again, youth is mentioned as a key stakeholder group. 2024, second high-level meeting on AMR, greater youth participation in health and governance and NAP. So if you look at all these member state endorsed documents, there is a clear reference to young people. And at WHO, we feel that young people may be one of the most important pathways to reach out to wider stakeholder groups and catalyze a broad-based action on AMR. So if you want a broad mobilization to happen on AMR and not just limit antimicrobial resistance and broadly treatment of infectious diseases as something managed only by the health sector, we have to engage young people. So it is a necessity, and it's not a good to do thing. If you look at when we started working on youth engagement, I think most of the work happened after 2022. Why? We had a global consultation on awareness raising on AMR, which is held in the middle of 2022. And close to 200 people from all the global agencies and networks participated in the particular meeting. And then we tried to identify what are the priorities for AMR awareness raising. And we found out that apart from the core constituencies of the quadripartite, for example, core constituency for WHO is the healthcare workers. Beyond that, there are 4 priority target audiences for AMR awareness raising. One was young people, media, parliamentarians, policymakers, and regulators. And why young people? There was a clear answer there. Young people form a potential demographic of future healthcare providers and consumers. So the awareness and behavioral change that we are able to achieve among young people can yield us huge benefits in the medium and long term. Second, from a healthcare provider perspective, whatever we invest in training young people, especially those who are actually studying to become healthcare providers, again, the competencies that they acquire will give us dividend in the long run. So after that, we started developing various projects and initiatives for young people from 4 different angles. One, we wanted to develop networks so that there is a dissemination of knowledge and best practices between networks led by young people and networks working for young people. That was one. The second was started working on strengthening the pre-service training and education so that people are aware and competent, future healthcare providers are aware and competent to deal with AMR. The third was greater awareness raising among youth-led networks. For example, we reworked on some of our approaches towards AMR awareness raising to make it more youth-friendlier. Can we actually make some of the core messaging relatable to young people? For example, if you tell a 25-year-old who's quite healthy and who's quite happy that, probably in your old age, you're going to get a drug-resistant infection, they don't care. People won't care. And that's the natural human tendency. So how do we make it more relatable? Can we make it to something more relatable to young people? For example, applying makeup in a store, or something related to taking care of pets, or swimming related accidents, or skateboarding injuries, depending on the cultural context you're from. We also adapted some of our messages that way. And again, focusing on school children, primary and secondary education. That was a demographic which we didn't really focus on before. But after that, we decided that this is also a priority because they are also young people. So we see young people as advocates and champions. We see them as agents of change in communities. We see them as highly competent future healthcare providers who can lead the global AMR response and strengthen it. So I wanted to introduce a few products and publications from our side, starting with what we have for strengthening the pre-service training and education. One, in 2018, we published a WHO competency framework for health workers, education and training on AMR, which kind of outlined what are the core competencies required for various cadres of healthcare professionals, the prescribers, pharmacists, nurses, public health program managers, laboratory technicians. It was followed up by a curricular guide, Health Workers Education and Training on AMR Curricular Guide, which is co-published along with Public Health England. Again, what are the quality and standards required to actually ensure that the competencies identified in the competency framework is actually rolled out, and how to measure it, how do you assess it? So those kind of things. And just to give you a brief overview of how the competency framework looks like, as I mentioned, it covers different cadres of healthcare workers. It also has different domains. It has domains related to infection prevention and control, awareness related to antibiotics, appropriate use of antimicrobial agents, use of diagnostics. So different domains. Under each domain, it was very clearly mentioned what are the knowledge, skills, and attitudes required. And the curricular guide, again, is a very, very simple tool. It follows a metrics model, and it looks at different levels of knowledge, starting with basic biology of bacteria, viruses, parasites, and fungi, going on to common infectious syndromes, use of antibiotics, infection prevention control, diagnostic stewardship, and leadership and communication. So for each of the different cadres of healthcare, future healthcare professionals, be it prescribers or non-prescribers or public health program managers, what level of learning is required to cover each of these 6 different domains. And it gives very structured modules to actually deliver this in a university context. And it also gives an outline of conducting an institutional AMR curricular review and what the methodologies, which all methodologies should be applied. So again, gives ready-made modules which can be applied or rather delivered in a university context. This was followed up by curriculum assessment tools. This one is on for medical education. Again, it's a rapid methodology to assess the robustness of teaching content related to the core competencies that I mentioned before. So in a university context or a medical school context or even in a national context, can we do a very simple rapid assessment looking at the competencies? And can we actually identify what are the gaps in those competencies and the curricular content required to achieve those competencies? And can we actually use it as to facilitate periodic structured discussion? So curriculum improvement is not a one-time activity. It is not essentially a teacher-led activity. Students can also be a very big part of it. So, and can we use this tool to facilitate periodic structured discussions on curriculum improvement so that it is not a one-time activity? People do it regularly, routinely. Just to give you an outline of the structure of the tool, it has 2 different major components. One is a curriculum assessment tool to evaluate the curriculum elements for medical education. And second, there is an institutional readiness assessment tool, which gives an outline of which gives a methodology to evaluate the infrastructural and functional arrangements to deliver the AMR curriculum. So if the medical school doesn't have the appropriate facilities to deliver it, there is no point in having the medical curriculum sitting somewhere in the shelf. So it can be completed in a half-a-day workshop. So it's not an intensive activity, and it can be led by students also. You can do evaluation of your own curriculum. And we are working on pharmacy and nursing versions of the curriculum assessment tool and hope to publish it by the end of the year. One major instrument that we had put together was the quadripartite working group on youth engagement for AMR. Again, it is a set of 14 fantastic individuals representing 14 different countries and 14 different youth-led and youth-serving organizations. And if you can see the person on the top right corner, was one of our youth working group members, and now he's part of the extended React network. So we take champions and we empower them to be very, very impactful. And this has worked out very well for us. And the impact they were able to make in the global health space is just fantastic. Just to give you a couple of examples, uh, they, they were able to come together, have a very deep consultation process, and come out with a youth manifesto on antimicrobial resistance before the UN General Assembly high-level meeting on AMR. And they even launched the youth manifesto at a meeting in New York before the high-level meeting. So it was all youth-led. We didn't have too much of inputs from our side. One other example is they published a comic book, Leslie Got Malaria, focusing on drug-resistant malarial infections. And now it's translated to close to 10 languages. And they're right now working on another set of comic books, one focusing on fungal infections and bacterial infections. So these are self-propelled activities led by this fantastic group of individuals. And we've also supported them in several ways. We've made sure that their voice is heard at all the high-level convenings, be it UN General Assembly high-level meeting on AMR, which also incidentally had political commitments, or rather commitments related to youth engagement and AMR education at different levels. If you look at the global high-level ministerial conference on AMR, which was held in Kingdom of Saudi Arabia, again, we were able to push the agenda and give them a session, give them a full session, and they were able to actually put together a video and show it to all the ministerial meeting participants. And they were also recognized by an Emerging One Health Leaders Award during the ministerial meeting. And you can see the youngsters with that particular award. They were also very, very active during the AMR awareness week, be it 2023 or 2024. Again, different webinars, different meetings, different on-the-ground engagement activities. So this has been a very value for money exercise. We had the last annual meeting in Nairobi, and this year we are looking at possibly having a meeting in November in Dar es Salaam. If any of you are from Dar es Salaam, you're welcome to be a part of the extended group. So another product I wanted to introduce is the AMR Toolkit for Youth Engagement. This was a quadripartite publication. WHO led the process, but it was published as quadripartite. This is a very simple tool to empower young people to lead, innovate, and sustain the global AMR response. So what it does is it breaks down AMR, it de-jargonizes it, and explains it to young people and gives them all the right tools to act. So if you want to launch a campaign on AMR, you have a campaign planning tool, you have tools to craft the social media messages, you have tools to actually put together a press release, you have tools to actually put together a campaign plan, a budget. So whatever you need, it's all there in this particular toolkit. So it is not just targeted at young people. This is a tool which anybody can use to actually engage young people in the AMR response, or co-opt them into the AMR response. So again, I'm just trying to give you an outline of the tool. As I mentioned, it has everything, from campaign scoping guide, worksheet, how to write a concept note, how to write a sample terms of reference, a fundraising plan, campaign management guide, how do you put together minutes of meetings, how do you put together a social media plan, social media guide, how do you put together an M&E framework. So all of that put together into one resource, that is the quadripartite toolkit for youth engagement. It also has a very good resource pack, which actually refers to many standardized resources which are available for young people, including the resources put together by React through the React toolbox. And also it compiles a few case studies on good practices related to engaging young people on antimicrobial resistance. As I mentioned, all these worksheets and templates and all of that. Just to conclude, in the interest of time, as I mentioned, we don't see young people as just beneficiaries, but as key drivers in the AMR response. And we also feel, as WHO, we feel that equipping young people with the right knowledge, tools, and platforms ensure sustainability, because otherwise this global AMR response is not going anywhere. And what is needed for this is collaboration across sectors. We work as silos. We don't talk to we don't really talk to each other. Health sector response is very separate from One Health response. We don't even have any bridges with the education sector. Civil society engagement is also patchy in many parts of the world. So I think the collaboration is very essential to make sure that young people stay engaged in the global AMR response. And we also need to engage young people from diverse backgrounds while we are empowering them to be effective AMR champions. And we also feel that investing in youth leadership today builds resilient health systems for tomorrow, because many of these issues related to AMR are structural in nature. For example, access to healthcare or laboratory capacity. All of them are not, cannot be sorted out with small interventions. These are structural interventions which are needed. And youth leadership today can actually help us build resilient health systems which can solve many of these structural issues. So let's come together and empower young people to shape a future free from untreatable drug-resistant infections. And I'm very happy to see the wonderful participation in today's call and in this particular AMRLEP cohort. So all the best for you, and back to the organizers. Thank you.
Thank you so much, Doc, for that presentation. It's been an enlightenment, I know, for the youths, because many of them, even while we were interacting in the WhatsApp groups, were asking what tools are to their disposal, what can help them really mitigate this problem of AMR. So thank you for sharing the tools that are available to the youths, what they can use, how they can go about. And it's also just motivating to see what other youths have done, and to see that even after they've worked with you, they're able to get into other networks where they can continue to be champions of AMR. So thank you so much for that, Dr. Matthew. We really appreciate your presentation today and the perspective that you've given from WHO. So thank you. I'd just like to call our next speaker for the evening. Our next speaker is Dr. Ali Yahaya Ahmed. He's also from WHO. So Dr. Ali Yahaya Ahmed is an accomplished senior public health professional with extensive national and international experience, and he has key competencies in leadership, development, talent management, professional coaching, and mentoring. He is currently the team lead of the AMR unit at WHO in the African region. Thank you so much for creating the time to be part of this meeting today, and the floor is all yours. Thank you.
Thank you very much, ladies and gentlemen. Good afternoon and good evening. First, let me thank React Africa for inviting me to this important opening ceremony of the Z cohort of the antimicrobial resistance leadership program. I'm really honored to join you today as the team leader of antimicrobial resistance unit in the WHO African region. As we all know, the AMRLEP initiative is very important for our continent. It helps young and emerging public health leaders gain knowledge and skills they need it to fight antimicrobial resistance through a multidisciplinary and the One Health approach. And WHO work closely with the quadripartite partners, FAO, OA, and UNEP, as well as the African Union, namely Africa CDC and AU-ABAR, civil societies and various organizations such as React Africa to jointly combat AMR. In this context, I would like to highlight that this initiative is a strong and practical platform It provides to us strategic and operational tools to face the complexity of AMR and its impact on health system, global health security, and the sustainable development goal. We all know that young people are at the center of this fight. Without your active involvement, the world will face a huge threat. You are the next generation of public health professionals and policymakers who must reduce illness, disability, death, and the negative socio-economic effect of AMR. Ladies and gentlemen, to tackle AMR effectively, all of us must strengthen prevention, ensure access to diagnosis and treatment, improve governance, promote science and innovation, and secure sustainable financing. All this should be done while aligning with the latest WHO frameworks, among other tools that has been mentioned by my two colleagues, Dr. Matthew, Philip, as well as Professor Murphy, which calls for mainstreaming AMR into primary health care and health security preparedness and response. Allow me to highlight that through AMRLEP initiative, you will further strengthen your competencies in advocacy and technical support at our member state. You will further learn how to advance multi-sectoral One Health coordination, implement national action plans in the spirit of the One Health approach, raise awareness and education, and engage communities. My colleagues from WHO has already provided to you several tools related to awareness and education. You will also strengthen your understanding on surveillance and laboratories, stewardship, WASH, and IPC, among other critical priorities. Thank you very much.
Thank you very much for that speech, Doc. For now, I think the next thing that we're going to straight go into is just the presentation of the course. This is just for the students to understand what the course is about, and I know that Professor Murphy already touched on that a little bit, but I'll just expand a little bit just to explain what the AMR leadership program is, and the objectives and some of the expectations from our end, what we expect from the students. And yeah, just allow me to share my screen. Are we all able to see that?
Yes.
Okay. So welcome everyone once again. My name is Natasha Msonda Kaptula, and I'm a Gender Associate at React Africa. I'm just going to walk us through, give us an overview presentation of the AMR Leadership 3.0 program. So our outline today, we'll just start by introducing the program itself, walk you through the objectives, the program highlights, as well as the expectations for participants, and then we'll go into closing remarks. So we have heard from all the three speakers what a grave issue this antimicrobial resistance is. So AMR is a global health challenge or a global health threat, and it does not only affect our health, but it affects food security. It also affects development. It also goes down to even just social relations within societies. So in response to this, React Africa has come up with an initiative to mitigate the problem of antimicrobial resistance. So one of the initiatives that we've come up with is engaging the youth, which is how we created the AMR leadership program. And the main aim of this program is basically to just build capacity in young leaders on matters AMR on the African continent. So it was born out of the urgent need for strong youth leadership in tackling antimicrobial resistance. It's important for you to take note that the AMRLEP is such a unique initiative in that it not only allows you to collaborate with youth within your space and even in other countries in Africa, but also allows you to collaborate with or just have access to mentors, as well as gaining of practical skills, and just strengthen the youth-led initiatives, some of the initiatives or some of the ideas that you may have. So this is a space that really allows you to be very innovative and allows you to explore your ideas on how best to mitigate the problem of antimicrobial resistance. So this program is not just theoretical, it's also very practical in that you learn many skills and you tap into knowledge from people that have been working in the public health space for over 25 years, like you've heard from Professor Murphy. So the reason why we engage youth is not just because youths are future leaders of tomorrow, but because youths are leaders of today. Many movements have been led by youths. There's examples of Kenya. When you look back at Zambia, so Zambia's history, you'll see there's so many youth-led movements that have just been successful. This is because as youths, you have the voice to speak. And when you speak, people do listen. We are very deliberate about things and the way we go about things. When we are passionate about something, we really do aim to bring change and create the change that we want to see. So the AMRLEP brings students from all over the continent together, from diverse disciplines such as human health, animal health, the environment, social sciences, and this really just gives a true reflection of our One Health approach. That's really one of our guiding frameworks when it comes to implementing our work as React Africa. So we also equip students or just youths with leadership skills and knowledge, and the AMR leadership program creates a network of champions who will one day influence policies within the globe and also within just the African context. What are some of the objectives of the AMR leadership program? One is to build capacity of tertiary level students, such as yourselves. Two, to trigger interest and commitment to AMR mitigation. This can be done by increasing the prioritization of AMR-affiliated careers and emergence of AMR champions. One of the things that we want you to take away from this is that after you undergo this program, we want to see many more youths entering the AMR space and just
doing a lot of work around AMR. So this program really should just ignite a light in you that will even burn much more than it is as you are joining it to do work that focuses on AMR, because this is a very serious global health threat. I'm sure we also, the statistics that Professor Murphy presented on how many people would die if we do not mitigate the problem of antimicrobial resistance. And lastly, to strengthen youth voices in AMR mitigation at regional and global levels. The youth voice is very important, it is very impactful, and we really need youths in the space to fully mitigate the problem of AMR. What are some of the program highlights for these cohorts? We have many, many exciting things for you during this cohort. This cohort will run for 3 months from September to December, and it will have different sessions, altogether 12 sessions on different topics, policy governance, stewardship, community engagement, youth engagement and campaigns, research, as well as leadership. And some of the expected outcomes are just gaining of new skills, confidence, networking, as well as advocacy and just advocacy impact on the community. We also will allocate the participants into smaller groups. This is to improve your interactions with mentors and also your peers. So I know that you're already in one big WhatsApp group, which has been very interactive so far. Well done, and give yourselves a pat on the back. But we'll also further break you down into smaller groups. And this is just very important for your group discussions, because there will be some weeks where you'll be given some homework that you need to go and discuss in your smaller groups, and then later on hand in some paperwork on what you've done, or even maybe make short presentations during some of the sessions that we'll have. Additionally, we'll also provide some material that will be shared with you before a session. This is just to adequately prepare you for all the sessions that you have. We don't want you walking into a session with zero knowledge and you being unable to even ask questions or just pitch in where you can. So that's those are some of the exciting things about the program. What are some of the expectations? What do we expect from the participants? So first of all, this program is supposed to be very engaging. The WhatsApp groups, the students need to be very active. You need to respond to messages that have been sent, questions, comment as often as you can towards material that's being sent, short video clips, give your opinions and things like that, because again, we are trying to help youths or create a space where youths can speak up and where their voices can be heard. And at the end of the day, our hope is to co-create material with you, with the participants of this cohort. So also to commit to collaboration. This is simply just working within your teams, the teams that you'll be putting. It's just important for you to meet when you have agreed to meet for your weekly discussions or bi-weekly discussions, depending on what you agree as a group and when your work is needed to be handed back in. So it's important to also share ideas. And
my name means communication.
Tawela, please mute your mic. Okay. So yeah, this is a place where you can network with your mentors and even just your youth and create youth-led organizations. From the previous cohorts, we've had many youth-led organizations that have been born out of the previous cohorts. So this can be something that if you decide to do, you can work towards and really make an impact on the African continent. So it's important for you, in order for you to qualify for graduation, to meet at least 80%, attend at least 80% of all the sessions that will be held. So you have a total number of 12 sessions, but in order for you to attend, you need to have attended at least 80% of those sessions in order for you to qualify for graduation and certification. And certification will be done at the end of the program, which is after all the 12 sessions are delivered. So we also want you to contribute to your community and not just keep this information after learning it. So this is a place where you learn, carry the information and take it back to your universities. You can use this to even decide to use it for your paper at school, your research paper, your proposal, and see what you can create. Maybe React Africa or WHO may be interested in collaborating with you. This is how you create opportunities for yourself as youth. So be very innovative in the things that you come up with and just the ideas that you have. This is a space that has really been created for the youths in this group to really shine and just be the best that you can. So apply the lessons that you've learned in the universities and also in the communities. Take back this knowledge that you're going to learn today on how to mitigate the problem of AMR to your homes, to your communities, to your friends, to your roommates, and even to your lecturers. You know, learning never stops. So even your lecturer may still need to learn something from you. Who knows? One of the other things is that we very much expect you to be champions of AMR awareness. And as you go out, to not continue to be the problem, but to start being the solution. Just being the solution to antimicrobial resistance. So from what you've heard today, we expect some behavioral change in some of the things that you do. I mean, we haven't gone in depth in explaining how you can mitigate the problem of AMR, but at least you have an idea of, oh, when I misuse some medicine, this might be the result of this. And there are some tools that have been shown to you by Dr. Philip Matthew of really just what you can do to be part of the solution. So this is the time after this call, go and download some of those documents, read through and just grow your understanding on AMR and be part of the solution. Yeah, so with this, I would like to wish you guys all the best. And I pray and hope that all of you will make it to the end of the program and that we'll have an entire class graduate. So welcome and all the best. Thank you. And so as the moderator, I'll just like to pass on the mic to Mukuza Mwaya, who is my colleague, and she will be sharing a detailed outline or just an outline of the courses, the sessions, and when you expect to have what particular session in what particular week. Thank you. Mukuza, the floor is yours.
Okay, thank you. As mentioned by Natasha, my name is Mukuzo Mwaya, and I'm a Research and Project Management Associate with React Africa. Currently working under our Youth Engagement Portfolio. So I'm just going to share a short outline of our program. So once again, welcome to the AMR Leadership Program for tertiary students in Africa 3.0. So over the next few weeks, or should I say over the next 12 weeks, we're going to journey together through different interactive sessions, discussions, and activities just to build your leadership skills in tackling antimicrobial resistance. So this is just a quick overview of what to expect. So we will have sessions every Saturday at 9 a.m. Central African Time. And our sessions are as follows. So our first session will be on the 20th of September, which is this coming Saturday, which will be an introduction to AMR. This will just look at understanding what AMR is, the different drivers of AMR, and why this matters. Our next session will be 27th of September, which will look at AMR and SDGs. This is just exploring how AMR affects the different sustainable development. Next session will be on the 4th of October, just looking at One Health systems approach. Sorry, can you still get me?
Yes, we can, because you were kicked out for a bit, but we can hear you.
Okay. Okay, then our next session is on the 11th of October, which will look at policy, governance, and NAP alignment. These are the national action plans. This just looks at how policies and national action plans guide AMR action. Our next session after that will be on the 18th of October, just focusing on AMR, IPC, which is infection prevention and control, and antimicrobial stewardship. On the 25th of October, we'll look at the role of research in AMR, looking at why evidence and innovation matter in AMR solutions. Thereafter, we'll look at partnerships, resources, and monitoring and evaluation. Following that, we'll have leadership, project management, and design. Thereafter, we will look at communication and community engagement. And our final session before we have actual on-ground work looking at what we've learned so far. We will look at the youth perspectives and development of AMR campaigns. So as Natasha had mentioned, this is not just a program in which we just teach, or this is a program that allows you to interact, to learn different skills, and also use these skills in your own communities, be it your universities or your actual communities. So our final assignment will be an in-person WOW campaign. So WOW is the World Antimicrobial Awareness Week. So to commemorate that, we, as part of the AMR leadership program, will come up with small campaigns that can be done within our universities or communities. That is the reason why our final session before that will look at the development of AMR campaigns, looking at the youth perspective. So this is just a brief overview of an outline of what our sessions will look at. As Natasha had mentioned, you will be in smaller groups, fellow students who were part of our previous cohort of the AMR leadership program, and we will also be available and there to assist throughout the program. Once you're separated into these groups, more detailed instructions will be given every week. You have different activities or assignments that need to be carried out based on the sessions you have, and will ensure that the interaction will continue weekly. And please, as Natasha had mentioned, let us keep this program very interactive, as this is necessary also for you to graduate and for you to just learn different things from different perspectives, as we have different people from 23 countries that are in this program. There's a lot that we can learn from each other as we work together to see how we can mitigate AMR in our African context. So let's continue working together, and I wish you all the best, and thank you.
Sure.
Thank you very much, Mukuzo, for that. So we have come almost to the end of our program today, but before we close, I would like to invite our last speaker for the night. He'll be giving closing remarks. This is our youth engagement lead at React Africa, and his name is Mr. Olen Hamatanga. Olen, the floor is yours, and thank you.
All right. Thank you so much. A lot has been said, but it's just a few key takeaways and just reaffirming the commitment that all of us here from 23 different countries have committed to do. As we open this transformative journey of the AMRLEP leadership program, we must also be reminded that antimicrobial resistance is not just a medical challenge. It is a leadership challenge that all of us have to face head on. It's a systems challenge. It's a generational challenge that we, the youth of Africa, have to own. And this is so because around 60% of Africa's population is predominantly composed of young people below the age of 25. What does that entail? It entails it entails a deeper sense of belonging and ownership that we need to step up and claim as young people, because we are the future leaders, and the future begins today. And why do we say so? Because you are the future prescribers, you are the future caregivers, you are the future of dispensing medicines. And as such, the future of AMR mitigation entirely rests in our hands as youths. This program is more than just a learning experience. It is a call to action. It goes over the next 3 months of rigorous learning, sharing experiences. We are building on a knowledge base, building capacity. We are building a movement of empowered, multidisciplinary, and above all, a committed change in AMR mitigation. It's our call as young people to change the narrative. As we begin this journey, let us begin the journey with full force of leadership, stepping up into the global landscape in mitigating AMR. And I'm very convinced, and I've got no doubt that this cohort shall manage through the different activities that are lined across. And I would like to re-emphasize, commitment to a program entails dedication, and dedication simply means a piece of you will need to die a little bit, and that entails commitment. 80% of the sessions to be attended, it is not about the time dedicated. It's about what are you going to learn out of that? How are you going to be a part of the bigger group of people trying to mitigate AMR? With these few words on behalf of React, as well as the senior team, as well as the partners that have joined to officially launch this cohort, would like to say congratulations on your selection, and count yourselves as a group of people that are about to drive the change. Let us begin, and let us all be the change that we so much desire to see. I submit.
Thank you so much, Mr. Hamatanga. So just one last thing I would like to request. If we can, could you please turn on your cameras like I have done, so that we just take a few screenshots of this remarkable and this wonderful launch, the successful launch of the AMR leadership program. So anybody that can, please do turn on your cameras. Thank you.
Hello.
Hi.
Hi, I'm Wango Philip from Juba, South Sudan. I'm very much excited about this program of AMRLEP. It's a wonderful program. Looking forward to participating, especially in the research part. I am an advocate for youth, and this has been my core emphasis by making sure we change the narrative in Africa, especially in my country. We are so much devastated by the resistance to antibiotic. It's so much. I think the data which will come out from this country will be alarming, and I hope that this program will be extended fully in my country in the near future. So I would like to work together with you and my other colleagues in the other countries. Let's join our hands and fight this pandemic, which is becoming a problem to the global world. But I hope through our commitment, we will succeed. Thank you so much for this program. I look forward to learning more from you. Thank you.
Thank you so much, Wong. Thank you. All right. To our IT specialists out there, have we been able to take some photos?
TM, have you managed?
I did not know I had that task, so give me 2 minutes. And apologies for that. All right, so at the count of 1 minute. So at the count of 3, please give me your best smiles. I'll take this in 3 shots because I have 3 pages. So just make sure you smile at whatever time, right? Okay, so 3, 2, and 1. Okay, that is screen number 1. Then again, I indulge you. 3. Are we ready?
Yeah.
Okay, 3, 2, 1. And one final one, just bear with me. And my last page. 3, 2, 1. There we go. Congratulations, everyone.
Thank you so much for making the time, and have a good night, everyone. And to the participants, see you on Saturday at 9 a.m. Bye.
Bye.